I'm often asked, who's a good candidate for insemination or IUI? Dr. Norian, am I a good candidate to start with the more basic treatments? And I tell people it really depends. It depends on a few key things. So number one is going to be female age, how old a woman is. So remember, our peak fertility is when women are in their 20s, right? As time goes on, when women are 33, 34, 35, our fertility, our egg and embryo quality start to decline. Now, that being said, I've for sure done IUIs in women in their mid-30s, but we want to pick the ones who are going to be the best candidates. So IUIs, they're most effective women who are going to be a little bit younger and women who have not only a good number of resting eggs, or resting, we call them antral follicles, but also a strong AMH level, or anti-Müllerian hormone level. Another thing is, are your fallopian tubes open, right? Do you have huge, big uterine fibroids? We want to make sure that those are healthy and that the egg and sperm are going to be able to meet up with each other inside the female reproductive tract. Another key aspect, believe it or not, is do you have access to good sperm, right? For gay women that I help, they oftentimes will use donor sperm, whether it's a known donor or using sperm from a cryobank. And that is an amazing way to help people add to their families. But also, we work with people having heterosexual intercourse. And sometimes guys, remember, 40% of patients that I work with, there's a male factor. Whether it's male alone, 20%, or male plus female, another 20%, we gotta check the sperm. How many IUI cycles should I do in general before I start thinking about other options? That's a great question. So number one, pregnancy rates, they're about the same for cycle number 1, 2, and 3. Now, cycle number 4, 5, and 6, believe it or not, the pregnancy rate will decrease per cycle. So usually in the bad old days, or the old days, let's just call them, doctors like myself, reproductive specialists, they would try 6 rounds of IUI before they moved on. For me, John Norian, I typically will recommend let's try 2, 3 rounds, maybe 4, depending on a person's age and situation. And then if you're not pregnant, then we sit down, we have a sit down, and we sort of talk through it. That being said, usually during cycle 1, 2, and 3, I'm going to be making adjustments because I'm just that bit particular. Okay, use Clomid this cycle, maybe we can use letrozole. Maybe we need to use HCG. Maybe we need to time our trigger slightly differently. Things like that. So good strong ovaries, good healthy age, pretty good uterus with open fallopian tubes, and then access to good sperm. Those are going to be women or couples who really should start with IUI.